So Invest International Health is one of the 5 pillars, and we're doing a lot of work in Africa and also partly in Southeast Asia. And I think for us, looking at the theme for today and just in general, the creation of impact for us in the health space, largely also through a gender lens. I think one of the things for us, we have development capital. It's a relatively small number a year, it's 9 million. But in the end, what we have found that it's not about the amounts that you put in. So there are two angles to it. One is that with a relatively small amount, we can take a high risk. So for us, we find partners to work along with us that either are a little bit more risk averse than us and can piggyback along. That we take we take 50% of the risk generally. That would also help them work in a very early stage to develop project opportunities. What I found also is that it is the DFIs always hunt in herds. And I think there's a lot of reliance on others for the work to be done. And so what I really like about the DFIs is that there are substantial amounts of money available. What we have found with the development capital that we have is that we generally find ourselves as the only national promotional institute that is active on a certain deal. And we find other types of partners, whether it's NGOs, whether it is corporates, original OBMs, for instance, that co-invest in an opportunity with us, and also at times the local government or another local entity that gets involved. And if everyone chips in a relatively limited amount of money, in the end, it's not so much about the money when you're in an early stage development, but what we really like is the opportunity to have totally different types of organizations at the table. So we tend to have a joint impact objective, and the narratives are relatively easily aligned. But then especially having different parties that look at opportunities, impact opportunities from a completely different perspective is what, if you talk about blending, and I don't want to get carried away in all discussion about semantics on what is blending and what is catalyzing and what is mobilizing. But, in the end, it is bringing other parties along. And for us, one of our mandates is also that we have to be additional. And additional basically means for us that if we don't do it, nobody else does, and it doesn't move forward. So we need to have a unique role. We find other parties that also have a unique role. So one of the things we spend a tremendous amount of time on, for instance, is one of the counties in Kenya, where together with an OEM and an NGO, we developed an opportunity for improved primary healthcare. Because we strongly believe as an organization that safe from prevention, because that's a whole other discussion. But if you invest in primary healthcare, you can get the best improvement into the health of the population. And that we definitely saw that with an NGO and an OEM, we had so much to bring to the table, and we could leverage on each other's strength, not just financially, but also the expertise that we had, the context that we had. So in the end, it was a tremendously interesting journey. The pitfall was also, and that's something I have to admit from my side, that I slightly had underestimated the value of the other parties at the table, because having an OEM on board makes it very much equipment driven. And having an NGO on board basically brought our solution, because it was a PPP. There was a relatively large training component, because that's what the NGO primarily did. So one, it gave us a lot of insights, were extremely helpful. We got a lot of people on the table moving forward with the project. The flip side is that we basically over-engineered the solution. So that was an important lesson that we learned from that one. Now, luckily enough, in Kenya, there are another 46 counties that we can look for ways forward. So there's a lot gained. But bringing different parties at the table, one, of course, with funding, because you do need your funding, but definitely also with different expertise and connection has proven to be very helpful.